I believe truly that femtosecond laser, as it relates to its functionalities in cataract surgery, we are just scratching the surface. The innovations that have already happened based on our feedback between faster on and off times, with the different ways to make us more predictable as surgeons, with incorporating more technologies with the preoperative diagnostics and streamlining it and having those streamlined into the LENSAR system. Those are just small examples of how the company has actually taken our feedback and used those relationships in order to improve the laser. And we are just starting. I think that the LENSAR is going to continue to take that feedback and make this unit the best unit as it relates to femtosecond laser and cataract surgery. Secondly, let's talk about the energy that is actually being put in the eye. As compared to other systems where we manually have to input the amount of energy we're going to use, the LENSAR laser, through each of the steps, applies different amounts of energy as it relates to lens density as well as what work it's doing on the cornea versus lens. This is important because, as we know, the amount of energy can actually be related to levels of inflammation, which potentially leads to intraoperative miosis. So being able to mitigate that energy is quite important. And most importantly to me, what I enjoy is the refractive outcomes and the predictability that the LENSAR laser system now affords me as it relates to astigmatism correction, the different nomograms I can place for astigmatic keratotomies for the lower levels of astigmatism, but with toric lens implants, the IntelliAxis L, which puts the little refractive markings on the capsulotomies, as well as IntelliAxis C, which are the little intrastromal corneal markings that I appreciate, especially for smaller pupil sizes. But ultimately, it incorporates all of that clean preoperative data from the different technologies, my NIDEC OPD, my Cassini, streamlines it right into the LENSAR to account for iris registration, which means accounting for cyclotorsion, and identifying the proper magnitude of astigmatism and the proper steep meridian for astigmatism management. The LENSAR laser makes me a more confident surgeon, period.